Dr. Andrew Newberg is the research director at the Marcus Institute of Integrative Health at TJU and is a professor in the Department of Integrative Medicine and Nutritional Sciences and in the Department of Radiology. And so it's interesting to see what Jefferson highlights about you, which versus what your own website does. But I'm going to highlight what your website says, which is that your work focuses mainly on how brain function is associated with various mental states, in particular religious and mystical experiences. You've also done a lot of work in aging and dementia, as we just said, Parkinson's, epilepsy, depression, and other neurological and psychiatric disorders. If this is still accurate, you've published over 250 peer-reviewed articles and chapters and 14 books, which have been translated into 17 different languages. And you've been listed as one of the 30 most influential neuroscientists alive today by the Online Psychology Degree Guide and won many, many awards. And so we're very, very delighted to welcome you and look forward to hearing your talk.
Well, thank you very much for that introduction. And I still have to check what Jefferson says about me. Hopefully it's not that bad.
No, it's fine. It's just that
it's probably more on integrative medicine and things like that.
Yeah, exactly.
Yeah. Which we often define integrative medicine as taking care of the whole person, the biological, psychological, social, and spiritual part, and certainly a lot of my research has been on the spiritual part of things, and that's what I'm here to talk about today. And so I've been very lucky over the last 30 years to be studying different aspects of religious and spiritual phenomena, a field sometimes referred to as neurotheology, for those of you who want to look into that. And the way I wanted to kind of think about my presentation today is talk a little bit about how we engage this entire field. And I'm hoping that I will give you all some practical information as well, both in terms of how you might manage patients yourselves at Moss in terms of your clinical work, but also the research piece to this, which is obviously a big issue for me, and how they kind of interweave with each other. So I'm going to start by sharing my screen. And let's see, here we go. Hopefully you guys can see that.
Yeah.
All right. So I think, the first question that I frequently get asked is, why are you doing this work in the first place? And I think, why are you looking at the relationship between spirituality or religion and brain health? And I think, the short answer is that if you actually go into PubMed or the medical literature and you look up research studies that have been done on this topic, there's actually quite a lot. And in many ways, it's been kind of an exponential growth over the last 20 years, with now maybe, several thousand studies being done that have looked at this relationship, the relationship between religion or spirituality, and we'll talk about that differentiation shortly, on both psychological, sort of mental as well as brain health. So kind of the psychological as well as the neurological, actually on all aspects of health. So that includes, more general aspects related to health, but obviously today we're going to be focusing more on the brain health related issues. So a lot of these studies have shown an effect. Many of them have been positive effects, as we'll talk about, sometimes negative effects. And I think the ultimate question is that if these effects occur, how and why do they occur? And that has been really a focus of a lot of my research. This field of neurotheology, as I just mentioned, really spans from the very practical kinds of discussions that most of which we're going to focus on today in terms of clinical information, clinical outcomes, what practices or approaches might be useful in a clinical context. So very pragmatic kind of information, to broader discussions about the brain and the mind and consciousness and so forth, as well as very esoteric questions about the nature of reality, questions about philosophy and epistemology and theology. So, to me, it's a very exciting and dynamic field because there's all kinds of information that we can talk about. Today's focus is going to be a little bit more on the practical side and really focusing on implications for brain health, but we'll talk a little bit about the implications for some of these other aspects, including some of the esoteric questions, at least towards the end of the conversation. So what are the issues that we have in terms of studying religion or spirituality and brain health? So what I'm going to do, and I've sort of divided the talk into these 5 main categories, which is we're going to talk a little bit about definitions. We're going to talk about targets of research, targets of clinical utility, measurement, both clinical as well as research, the actual clinical relationships that we can look at and that have been reported on, and then ultimately mechanisms of action, which has been a lot of the focus of my own personal research. So let us break down these in a little bit more detail. So the first question, and I actually published a book about 10, 15 years ago now called The Principles of Neurotheology. And the first chapter really delves into this whole discussion about definitions. And it is, on one hand, it's kind of dry stuff, but to me, especially in this field of neurotheology, it becomes very interesting and very, there's all kinds of fascinating questions, and a lot of where the clinical or research work goes has a lot to do with the definitions that we have for these different ideas. And so, in fact, one of the things that I do with a lot of people, I'm not going to do it here, but I sort of challenge each of you to think about this, is to maybe go home tonight and take out a piece of paper and write down spirituality on one side and religious or religion on the other side, and think about how you would define these terms. What do they mean? What do they mean to you? What do you think they mean to your patients? How do you think about these concepts? And it is quite challenging to think about. Obviously, if I were to bring a group of scientists together, a group of neurologists, a group of psychiatrists, a group of sociologists, anthropologists, philosophers, theologians, each one of those groups would come up perhaps with different definitions of these different terms. Now, there's a couple of important things, though, that I like to talk about, which is that one, we need to develop operational definitions. And what I mean by that is that they have to be definitions that we can kind of utilize and work. So, for example, if the definition of spirituality was the soul's connection to God, that may be a great definition from a spiritual perspective or a theological perspective, but I have no way of measuring the soul's connection to God. I have no brain scan way of doing that. There's nothing that I can do. So it's not very hopeful. What I need to do is try to come up with operational definitions, and I'll talk about some of those in just a moment. We need to have narrow definitions in the sense that we need to be able to put our definitions together in such a way that we can know what we're talking about. But on the other hand, sometimes if they're too narrow, that can impede research. For example, if we were to say that being religious is a belief in God, or if you took a Christian perspective, a belief in Jesus, then what do you do with people who don't believe in God or don't believe in Jesus, but may still have a very profound religious or spiritual belief system? For example, Buddhists who don't really believe in God, at least the way the monotheistic traditions do, may still feel a great deal of spirituality and feel that their religious tradition is very important in their lives. So we could say, well, let's be very inclusive, and that can be good. But sometimes if you get too broad with your definitions, then it becomes challenging to measure. And we wind up bringing in a lot of things that people, like, for example, a lot of times people come and tell me that their spirituality is art or creativity. That may be very appropriate to say, or maybe it isn't, so I have to think about, how we decide to bring in these different definitions, and what do we do about what might be arguably unusual kinds of religious or spiritual expressions, like cults or people who are willing to, terrorists who are willing to kill people in the name of God. So what do we do with those kinds of definitions as well? We also have to think about how we differentiate specific elements from spirituality and religion in terms of general psychological constructs. For example, a lot of people will talk about spirituality as a feeling of the love of God, or a feeling of connection with the universe or something like that. So, love, we all feel love of other things. We feel love of a spouse, of a child, of our pets. So if we feel a love of God, is that the same or different than what we're talking about when we're talking about the love of the general feelings of love that we have, different thoughts and feelings that we might have? How do we express those in terms of the differences between a religious or spiritual feeling versus a non-religious feeling? And so, again, if you're, reading the Bible as a sacred text, and you feel something, how is that different than if you're reading a newspaper or reading a medical journal or something like that? So these are very important things for us to think about in terms of how we differentiate the elements that occur within religion and spirituality. And then based on whatever definitions we come up with, how do we develop appropriate tools? So about 20 years ago, actually probably going on 25 years ago now, when a lot of us were just starting to look at these kinds of questions, a group of scientists were brought together. It was about 80 scientists, many of which were NIH-funded scientists, were brought together to talk about the relationship between spirituality and health. And after a very short period of time, this group decided that if we're going to talk about spirituality or religion and health, we need to define our terms, just as we've been talking about. So I want to offer these definitions. I'm not saying these are the best, but I think they're useful, and I just want to go through them briefly. So this group defined the criteria for spirituality as the subjective feelings, thoughts, experiences, and behaviors that arise from a search or quest for the sacred. And they define search as attempts to identify, articulate, maintain, or transform, and sacred as whatever that person felt was sacred, a divine being, God, ultimate reality, whatever. So, this definition is, I think, useful. There is an operationalized aspect to it because we're talking about thoughts, feelings, and experiences. So I can ask people, what are your thoughts? What are your feelings? And I can get an answer back, much like if I were to ask somebody how depressed they felt or how much pain they were in. These are subjective feelings. There's no way to just observe a person and say, they are in 3 out of 10 pain or 8 out of 10 pain or whatever. And we can kind of get a sense by how uncomfortable they may look, but we really don't know how they feel until we ask them. But again, at least there is a way to ask, and there's a way to try to get at a measurement of this. This also gives some narrowness. It's talking about a search for the sacred, but it gives it some broadness because it gives a fair amount of leeway in terms of what a search may be defined as or what the sacred may be defined as for a given person. So again, I'm not saying this is the best definition. I think it's a useful one. It was helpful for this group of scientists, but there may be many others. And certainly as we do more research, we may come to the idea that there are better and more nuanced definitions that we might have going into the future. The same group defined the criteria for religion or religiousness as including the criteria for spirituality and or a search for non-sacred goals. So this could be goals related to belonging, a connection with a group of people, a sense of meaning and purpose in life, or perhaps even a sense of wellness and health. Typically, this is in the context of a spiritual criteria, but nonetheless, it is typically a non-sacred goal that a person may be striving towards. Perhaps the one element of these definitions, which I specifically have found that tends to apply more to religion, is that the means and methods of the search receive general validation by a group of people. So there's a group of people who say, this is what it means to be Catholic. This is what it means to be Jewish. This is what it means to be Muslim, Buddhist, and so forth. Now, again, I often will say this, and then their hands go up and say, well, I belong to a spiritual group, and they define themselves based on what the practices are. So they're, why isn't that spirituality? And I think the bottom line is that there's a lot of overlap between these different terms. You'll often hear me using them kind of together because I just want to be inclusive of all different types of expressions of these things. But again, it's something for you to think about. It's something for you to think about in terms of patience. And in fact, actually, when people are asked, are you religious, are you spiritual, you get a 2x2 grid. I would say if you look at like the United States in general, about 2/3 of the people will say that they are religious and spiritual. You'll get about maybe 15 to 20% who are the agnostic atheist group who will say they're neither religious nor spiritual. There's a growing interest in the spiritual but not religious. So they have spiritual feelings, but they don't feel tied to a given religious tradition. And there's still a small percentage of people, maybe 5% or so, who say they're religious but not spiritual. So they adhere to religious ideas and precepts, but they don't necessarily feel something supernatural, or certainly it depends on how they themselves define these different terms. But again, it's something for us to think about, especially when we're developing research studies or when we're talking to a patient. Now, the next two slides to me are very important from a clinical perspective, but also a research perspective. But here, I think there's some practical applications for all of you to think about in terms of the patients that you may be seeing. How do we actually evaluate or try to get at a person's sense of religion or spirituality? most of the time when somebody comes in, and this may be true of Moss, I don't know. Certainly most hospitals have this. They ask you what you are, and you check a box or something. You say, I'm Protestant, or I'm Muslim, or whatever. But that obviously, is helpful, but it really doesn't get at what a person really is. It doesn't tell you whether they really adhere to the tradition, whether it's important in terms of the decisions that they're going to make regarding their health. It doesn't, it really doesn't tell you much. And it even doesn't tell you much about how they got to where they are. That's where, number two, the spiritual history sometimes can be very important. If somebody were to tell you, for example, that they were Catholic, you could have two very different kinds of Catholic. You'd have one Catholic who was, born Catholic, went to Catholic schools throughout their childhood, married someone who was Catholic, and here they are, 45, 50 years old, and they say they're Catholic. And that could be very different than a person who may have been born, in some Presbyterian, and maybe when they were in college, they dabbled in Buddhism. They eventually decided to reject religion altogether, but then when they were 30, they met their spouse and who was Catholic, and they decided that they would convert to Catholicism to keep the family consistent. And here they are at 45, 50 years old, and they're Catholic. So these are two completely different kinds of Catholic. And again, it's very important to understand not just what a person is, but how does it have meaning for them? And what is it, how are they going to make medical decisions? And in fact, one last little story about this, because it happened to me, was that when I was a resident in internal medicine, which was one of my background, both imaging as well as internal medicine, one night we had a patient on the floor who was having a lot of gastrointestinal bleeding. She was losing a lot of blood, and she was a Jehovah's Witness. It said it on her chart. So I go in at like 3 o'clock in the morning. I say, things are looking a little, we're very worried about how much blood you're losing. And since you're a Jehovah's Witness, we can't give you blood products, because that's, what Jehovah's, I would assume that she would know that, but I'm not telling you that they won't accept blood products. So I said, we can't give you blood products. And she said, wait a minute. She said, I put down Jehovah's Witness because they asked me what I was, and my parents are Jehovah's Witnesses, and so that's what I always have called myself. But if I need blood products, give me blood products. I don't want, I don't want you to hold off on that, for that reason. And thank goodness I had this conversation with her, because I was, we were holding off and thinking about how to handle this whole situation, when it would have been very easy for somebody to say, hey, you might need some blood products. Are you okay with that? And see what they say. So, and this, of course, spills into all different kinds of questions. I'm sure you all deal with questions about, even things like end of life issues and what people are comfortable with and what they want, and do not resuscitate orders, and transplants, and, all these different things. So, it's not just enough to know what somebody calls themselves, but what does it really mean for them? Another very important part, and again, I would think that in a rehabilitation hospital like yours, these next two, 3 and 4, how much does the person engage their religion on the basis of sort of social participation versus private practice? Because that can be very important. If somebody just, their whole religious belief system is tied up in the congregation and going to church and being a big part of this whole group of people who all participate together, if you now are in the hospital or in rehab or something where you can't get to that could be very distressing for a person. On the other hand, if it's somebody who says, I really just do my little prayers at home, and I, if I have to be, in a hospital setting for a month, or a rehab setting for a month, it's not really going to bother me as long as I have my sacred books and I'm going to do my prayer and so forth. That's fine. It doesn't matter to me. So, again, knowing not just what they are, but how they engage it can be very important in helping them deal with the sort of the larger issues that they're now facing. How much do they turn to their religion for support and coping? Again, very, very important. And even if you're not a religious person yourself, I think it's important to ask patients, do you have religious or spiritual beliefs that are important to you? Are there things that we can help you with? Are you going to use, is it important for your ability to gain strength and coping through this difficult time? And if so, do you need me to connect you to your congregation, to a pastoral care counselor? So you don't have to engage them in any great way, other than at least making sure that you understand what their beliefs are and what you might be able to do to help them to manage that particular part of themselves, so that while you're working on the biological piece and the psychological piece of who they are, you're also taking care of the other pieces, the spiritual piece as well, which can actually be very valuable, because obviously if people feel that God is there to help them to get through this whole process. They're going to tolerate the therapies. They're going to engage the therapies more aggressively. Whereas on the other hand, if they really think God has left them and they're kind of on their own, then, you know, a lot of times people kind of give up, and it can have a very negative consequence in terms of just how they engage their treatment. So very, very important stuff for us to think about. And then finally, the techniques, the practices that people do, like meditation and prayer, which we'll talk about shortly, and the experiences that people have, also a very important part of understanding religious and spiritual beliefs for people. Now, there are many different types of interventions which have incorporated spiritual or religious elements to it. There are research articles on all of these, feelings of sort of dealing with forgiveness. Sometimes it's forgiveness of the self, sometimes it's forgiveness of others, sometimes it's forgiveness of God. A sense of release or letting go of feelings, different cognitive and behavioral elements of spiritual interventions, cognitive behavioral therapy that can have religious elements brought into it. Then different practices, various rituals, dance, prayer, meditation, 12-step programs, all of which have different elements of religious and spiritual content, which can be helpful for people in various settings. This is, you know, the larger question is, which are the most helpful in what kinds of settings? That's not always so easy to know. But to me, it's important to ask people if there's certain practices that they do that they like, that might be helpful for them, that they might need help in engaging in. Maybe they need to go to the meditation room. Maybe they need to have a book that they need to do their practices. Whatever it is that they might need, it's helpful to know what it is and then see if it's something that can be useful for them in the context of their care. Now, going a little bit beyond this to measurements of spirituality and religion, if you look at the religious, if you look at the medical literature, some of the main ways in which people have measured spirituality or religion is by asking people how often they go to a house of worship. How often do they, you know, a lot of these studies originally were done, were Christian-based, because the United States had a pretty heavy, and still does have a heavy Christian-based population. So they would say, how often do you go to church? Or, you know, how often do you go to synagogue? Something like that. And if you're talking about that, I mean, there's a reasonable correlation that, arguably speaking, someone who goes to a house of worship every week is probably a more religious person than somebody who goes once a year for a big holiday or something like that. But obviously, that's not the whole story. It's not just how often you go, but how engaged you are when you're there, how important it is, how you might or may not use different religious tenets as part of your decision-making processes, how you think about yourself, your optimism for, you know, your ultimate outcomes. So there's a lot of different possible questions for us to think about. There are many measures that have been developed. Many of them are underused. In fact, I often think it would be, you know, so valuable to give some more detailed measures and questionnaires to people who come into hospitals and rehab centers and so forth, because we've just learned so much about what people really are thinking about on the inside. Most of these reports, most of these measures are self-report. Obviously, again, there's no way for me to just look at somebody and know if they're a religious or spiritual person other than by asking them and asking them how important it is. But, you know, that has its own limitations because you're asking people how they feel. There's a great book that's probably a little dated at this point. I guess it's about 25 years old, but still has some wonderful questionnaires and scales in it, called Measures of Religiosity. And it's my go-to for a lot of our research studies. It has about 130 or 150 questionnaires of all different kinds and all different orthogonal measures related to spirituality and religion that could be useful depending on what you're looking for and what you're trying to explore in terms of a research study. Now, so this gives us a little bit of the background of the religious spiritual part. Now let's start talking a little bit about the brain part. I'm assuming most of you know all of this, but I'm just going to make sure that we're all on the same page. So here we are looking at the brain from a side view. You have the frontal lobes on the left-hand side here, which are behind the forehead. Many different functions of the frontal lobe, but one of the key ones that we'll talk about in the context of religious or spiritual practices and experiences is that it serves as a kind of attention area. So the frontal lobe is activated when you are focusing attention on something. And so if you're focusing your attention on a prayer or meditation practice, then you're probably going to have increased activity in your frontal lobes. The temporal lobes along the side of the brain are involved in a variety of processes, including the visual system. So if you're looking at a visual object, a religious symbol, for example, then these parts of the temporal lobe may become involved. And at the junction between the superior temporal lobe and inferior parietal lobe, we see a verbal conceptual area. So this is where we receive auditory input, where we begin to have abstract thought processes. Other processes may be in this general realm, including quantitation, abstraction, and so forth. So there's a lot of different concepts that arise from this general area. The parietal lobe itself is a bit of an orientation area. It helps to take sensory information and helps us to kind of put together a sensorial map of space and where we exist within that space. So it's involved in the spatial representation of the self, and we'll talk about that in a few moments. And then as we get a little bit deeper into the brain, we have areas like the limbic that are part of the limbic system, structures such as the amygdala, hippocampus, and so forth, cingulate cortex, which are primarily involved in emotional processes, but also memory. And of course, it makes sense that we remember things that are emotionally salient to us. So it's interesting that some of the cognitive aspects of our memory are connected to the emotional aspects that we feel in our limbic system. But again, if you kind of extrapolate this to religious and spiritual phenomena, many times people talk about emotions like love, joy, awe, and so forth. So we might be thinking about areas of the limbic system that are involved in these kinds of experiences. Now, going a little bit more into the outcomes, and we will circle back to the brain part when we start talking about the mechanisms, but I just wanted to get that in there. What is the clinical relationship between religious or spiritual phenomena and mental health, for example? Many studies have shown positive effects. So people have found that the more often that an individual goes to a house of worship, this tends to reduce anxiety and depression. A colleague of mine, Dr. Lisa Miller, up at Columbia University, she's done a lot of research on religion as being protective in adolescence. It helps to reduce depression, anxiety, suicidality. It protects people, young people, against substance abuse and so forth. So, there's certainly some very positive elements here when we talk about how religious or spiritual belief systems can help people. Religion and spirituality are probably cited most people ask, what is your mechanism for coping with different issues and problems? Religious and spiritual beliefs are one of the most common forms of coping for people. And even when you start to look at very specific diseases, including things like cancer or heart disease, religious behaviors and activity are noted as some of the most common forms of coping. And when people have a strong religious background, it helps to reduce physical health problems, including cancer, heart disease. People have better outcomes. In fact, people have better all-cause mortality, interesting, when they adhere to different religious or spiritual traditions. And many practices like meditation and prayer have been specifically shown to reduce anxiety and depression or enhance a sense of meaning and purpose in people's lives. Now, how might something like this work? Well, here's the first brain scan that I'm going to be showing. This is a bit of a weird brain scan for those of you who have looked at brain scans before. You don't really see the brain here very clearly. This is a study that we did a few years back of people going through a spiritual retreat program. And it involved a kind of scan called a DAT scan. DAT scan itself is primarily used in Parkinson's patients to look for movement disorders and to look for evidence of abnormalities in the dopamine system. So basically what you're looking at are the basal ganglia here, at least on that top row. And this is a tracer that binds to the dopamine transporter. It also happens to bind to the serotonin transporter in a non-selective fashion. And that's what you see on the bottom row. This is the brainstem where the serotonin transporter is prominent. So this study involves scanning people initially and then sending them through a 1-week spiritual retreat program that was based on the spiritual exercises of St. Ignatius. And I apologize for emphasizing a little bit of Christianity so far in this talk that is inadvertent. We actually have studied virtually every tradition. Christian tradition, Jewish, Muslim, Buddhist, Hindu. We've looked at Brazilian mediums in trance states. We've looked at Pentecostal Christians and speaking in tongues. We've looked at Sikh meditation practices, mindfulness meditation practices. So we've really looked at the broad range, but we are somewhat limited by the groups that we have available to us. part of the reason that we wound up having this be a Christian-based retreat is that outside of the Philadelphia area in Wernersville, there is a Christian retreat center, which we were looking for people who go through very intense, very immersive retreats to see how that changes them. And that's why we chose this. We could have easily, had we had a local, Buddhist monastery, we could have done a Buddhist kind of practice. This is just happens to be what we had. So a lot of our studies have a degree of availability, so to speak. Are the people or the groups or the practices available to us, and are people willing to participate in these studies? And then, do we have funding to do a study like this? So again, the scans on the left are from one subject before the retreat, and then the scans on the right are after the retreat. And if you look at the top row, what I hope you can see is that there is less binding in the dopamine transporter. It's kind of more yellowy colors than the bright orange red that we see in the baseline scan, in the pre-retreat scan. Now, this caught me by surprise a little bit. In fact, the serotonin transporter is also a little bit down. It goes from sort of a more yellowy green to a sort of a darker green. And I should also parenthetically mention that almost all the studies that I'm going to show you and the colors and so forth, they are all quantifiable as well. So the colors represent the amount of radioactive tracer that went to these different areas. So all of this can be quantified and statistically analyzed, which is what we do in our papers. Now, getting back to this, though, what does this mean? So, what's interesting about this is that as I thought about this more and more, it really makes a lot of sense that as they go through this retreat program, what we see is a decrease in dopamine transporter activity. What does the dopamine transporter do? It takes up excess dopamine from the synaptic cleft after a neurotransmission release. What this means then is that since there's less dopamine transporter available, what this person then is going to experience is that each time there's a release of dopamine, that they are now more sensitive to it. They are sort of flooded with more dopamine. Less dopamine is taken out after the release of dopamine. And interestingly, this is the same exact thing that happens when you take a drug like cocaine. Cocaine stops up in the acute moment the dopamine transporter, which then floods the brain with dopamine, and you get this euphoric high. Remember, dopamine is that reward system, that feel-good molecule, so to speak. So this helps us to understand now that the brain of a person who goes through this retreat is going to be more sensitive to the effects of dopamine. So they're going to feel better. They're going to have more positive emotional responses. They're going to have less depressed responses. And so this to me makes a lot of sense. And in fact, if you look at the bottom row again, what we're showing is that there is less serotonin transporter. And this is, again, kind of analogous to what happens when you give people the SSRIs, because they now are able to, SSRIs are blocking the serotonin transporter. And what you're now seeing is that the person is having a similar kind of response by going through the spiritual retreat program. And maybe this helps us to, again, understand why they might be less depressed, less anxious, because we see this physiological effect. And these are baseline scans. This is not while they're meditating or anything, not while they're praying. It's what they're doing, how their brain is at rest. And so again, it's actually changing the way the brain functions by going through these kinds of practices.
Do you mind
Now,
interruptions, or do you
please.
want it to finish and then have questions at the end?
I mean, if there's a specific clarification, I'd be happy to answer that.
I mean, for that study, I mean, I assume that you also had people who were scanned on 2 occasions who didn't go through the retreat and showed an interaction between whether or not, which group was showing these changes. That was one question. So you want to make sure, we of course want to make sure it's not just a repeated scanning, right?
Right.
Effect. And then secondly, were these changes that if there was an interaction, was that correlated with any behavioral report of some kind of experience or, spirituality as a result of the retreat? So can you tie it to the behavior?
Yeah. So to your first question, we didn't do it as part of this study, but we have scanned healthy individuals initially and then in follow-up in the same kind of time frame. And yes, I mean, there's usually a very good stability of these scans. You will have a slow decline with age. So if I scanned you when you were 30 and then I scanned you when you're 70, you might look like this kind of thing. But if I scan you today and I scan you a month later or a few weeks later, then actually you have very, very comparable binding, usually within about 5 to 10% variability. So these kinds of changes really reflected what was happening in between. Now, we also get into these other questions about, so what would be an actual control, some type of control group. This becomes a very
Right.
big challenge for the whole field of neurotheology, because what exactly would be a control? Would you send them through some kind of educational program? Would you send them through some kind of practice where maybe you just send them to, where I am out in the New Mexico woods and walk around and just kind of enjoy nature or something like that. So there's always a big challenge for us to figure out what is a good, placebo control, because walking in the woods could be very relaxing and could give a person a kind of spiritual experience. Educating people can give different things. So it becomes challenging to know what is a sort of a true placebo, where theoretically nothing should be happening. But we do know, at least in terms of test retest, we don't see very much of a change. But in terms of doing a specific program, that becomes a bigger challenge for us to figure out. And in terms of your other question, with this study and with also some other studies, we have shown that there are correlations with changes in anxiety, depression, and so forth, and even cognition, depending on the circumstances. So these do correlate with different clinical changes that we see in a person. Now, these were not people with diseases, so to speak. So again, we have other issues with that, because people, weren't depressed to begin with. So I can't tell you that this will work in people with major depression, but these are some of the next studies. But there are other studies that have looked at practices like mindfulness and have shown that it reduces depression and anxiety in them, and that sometimes it can be just as effective as medication treatments for people, or psychotherapy, more traditional psychotherapeutic interventions like cognitive behavioral therapy. So hopefully that answers your question, but those are really important questions, and thank you for that clarification. Now, as I mentioned, a lot of this has been very positive, but it is not all rosy. And certainly many people have cited religious or spiritual issues with people when things do not go well. Sometimes people view religion very negatively. Sometimes they think God is punishing them for being a bad person when they were young, and that's why they got this injury, or that's why they got addicted to drugs, or whatever it is. And of course, again, if somebody feels that God is punishing them, they're going to be less likely to follow treatments and be, enthusiastic and optimistic about their outcomes. We also have to be careful about the idea that a lack of spirituality is the blame for a particular issue that they're having, and why they're having to deal with that. Now, interestingly, even positive experiences, sometimes people have had a near-death experience or a very powerful mystical kind of experience in their life, and we've cataloged a lot of these in our research. But sometimes, it's so overwhelming of an experience that when they then go to talk to their friends or clergy or something like that, they realize that people are kind of, not very accepting of that, and maybe they have trouble integrating it into their previous belief system. And so even a positive experience can sometimes cause an increase in anxiety or depression. Sometimes people call it religious struggle. So it does depend. In fact, actually, interestingly, when people are older, especially when they are in nursing homes and things like that, because they sometimes can't engage their religious beliefs the way they do, they can sometimes have an increase in anxiety and depression. And it can actually lead to poorer outcomes for these individuals, because they're not able to find their path to the traditions that they typically have used. And the last one, which is sort of obvious, but people who join cults, or commit mass suicide, or kill other people or whatever. Obviously, these are very poor outcomes, and not surprisingly, no, I know it's sort of a. When I originally wrote this slide, I didn't realize it was quite as amusing as it seems to be, but. But anyway, mass suicide is certainly a bad outcome, at least medically speaking. So, but what do we make of this? And how do we? What is it that draws people into a cult, or draws people? What is it that goes to makes somebody go to a website where, like the ISIS website says, "Gee, that's a great idea. Let's kill everyone who doesn't believe the way we do." So I think it's important for us to actually look at the brains of individuals who are going through these different processes, who find these different perspectives to be enticing to them, and to try to understand why they went in those different directions. And this is certainly work for us to do in the future. Religiousness has been specifically kind of connected with certain brain disorders. Some of the famous or well-known examples are temporal lobe epilepsy. There have been some, well-known examples of people who have temporal lobe epilepsy who have unusual spiritual experiences. Now, interestingly, though, it's a very small, there's a lot of people who have temporal lobe epilepsy, and only a very small percentage, maybe 4 or 5%, actually have these unusual religious or spiritual beliefs. So it's much more complicated and nuanced than just, oh, you have temporal lobe epilepsy, you have these issues. Schizophrenic patients, we're all, very familiar with, or, have all heard of the schizophrenic patient who believes that they're the Messiah or something like that. I'm always intrigued why they kind of, seem to adhere on to religious figures as opposed to, why don't they think that they're the next Bill Gates or the next Steve Jobs or something like that? But they tend to, think that they're the next Messiah or something along those lines. And so, why is that? People who have mania, sometimes in their manic episodes, can become hyper religious. And it even led to a very interesting article a bunch of years ago, but I always love this table, where they came up with the religious figures of history and tried to come up with a diagnosis of what they had. So they take somebody like St. Paul, and on the, his experience on the road to Damascus, if you're not familiar, where he sort of, gyrates around and then falls down, and then he couldn't see for several days. So they said, well, maybe this was CPS, complex partial seizures, that ultimately generalized, and then he had this psychogenic blindness afterwards. It's an interesting exercise. It's a bit of a futile exercise because obviously there's no way for us to ever know about these things. And I think it does ultimately have a certain degree of problematic elements to it as well, because we want to be careful about over pathologizing religious or spiritual beliefs. And certainly there have been books out there like The God Delusion, which obviously has a very specific bias to it. But what do we make of that? And I think there are some real problems with trying to explain religious or spiritual beliefs away as just brain disorders. And certainly some of the examples, I think, mental illnesses in particular, like schizophrenia, are typically chronic. If you have seizures, you usually have the same kind of aura and different, the same kind of experience over and over again. Whereas many of these individuals who are great religious figures, or even some of the people that filled out a survey for us about their spiritual experiences, it was a one-time phenomenon. Could it have been a seizure? I guess so. But usually if people have seizure disorders, then they continue to have these kinds of experiences over and over again. Mental illnesses typically are associated with decreased cognitive functioning, decreased social functioning, whereas many times these religious figures were able to galvanize entire societies and groups of people around them. So again, it doesn't mean that they didn't have pathology, but I think we also have to be careful about making that kind of an assumption. And as I've been mentioning, while there are certainly the negative side of religious and spiritual experiences, most of the time it tends to be beneficial, whereas a lot of these kinds of talking about it as a disorder, it seems to be a little unusual that they would have most of these experiences are very positive, whereas most of the time when you have mental illness, a schizophrenic kind of is aware of the fact that the hallucinations are problematic. And so again, I think we just have to be careful about over pathologizing what we understand about these religious and spiritual belief systems. All of this has led people to pursue different approaches to the treatment of different mental disorders that incorporate religious content. Meditation interventions like mindfulness have been combined with cognitive behavioral therapy and other therapies, and generally have been shown to reduce anxiety, depression, substance abuse, and so forth. These combination therapies have actually been as useful, if not better, than more traditional psychotherapeutic interventions. And you think about things like Alcoholics Anonymous, which invokes a higher power, and also has been one of the more successful treatments for alcohol abuse. Of course, again, it doesn't help everyone, so there's a long way to go in terms of understanding it. But it certainly seems that some of these combined therapies that include some type of spiritual or religious content can be helpful for people, and especially if that's an important part of their, of the way in which they think about themselves. So in the last 5-10 minutes, the mechanisms, I think, about how all this is going on, we've touched on this a little bit, but now I want to dive into it a little bit more detail. So I tend to divide the mechanisms into direct and indirect mechanisms. And by indirect mechanisms, what I mean is that if somebody's religious, sometimes they're doing certain things as part of the religion that wind up having ancillary health benefits. So for example, many religious traditions will tell you not to participate in high-risk behaviors, not to drink, not to smoke, not to do drugs, not to be promiscuous. Well, if you did all of that, you'd be a healthy person, irrespective of whether that was because of your religion or just because you decided that you didn't want to do those behaviors. Other practices like healthy dietary practices. If you're a Hindu, you might be a vegetarian. And a lot of research in my world of integrative medicine has shown that vegetarian diets and getting away from getting away from animal-based proteins tend to be a much healthier way of living. And so you might do better, not because you're a Hindu, but because you're a vegetarian, you're using those kinds of healthy dietary practices that are part of the tradition. And certainly going to houses of worship, being part of a congregation invokes a lot of social support, which can be very helpful, especially when you're dealing with different issues. And so, having that increased social support, maybe if you just played, part of a mahjong group or whatever, and you got good social support from them, that would be the same thing as getting social support from going to a house of worship. But again, the bottom line is that it's kind of an indirect benefit. It's not because you're religious, it's because of some things that are going on as part of the religious program that you're in. Now, the direct mechanisms of action have to do with practices like meditation and prayer, which have a direct effect on the person. These practices can reduce heart rate, can reduce blood pressure. They help to augment heart rate variability, which has a lot to do with the autonomic nervous system. And these changes have been shown to be beneficial. Obviously, if people reduce their heart rate, reduce their blood pressure, those are the things that we give people beta blockers for, to reduce their risk of stroke, heart disease, and so forth. The relaxation training also helps to improve your immune system function. When you're more relaxed, your cortisol level goes down, your immune system function goes up. There was an interesting study a bunch of years ago that showed that if you had people meditate before they got a flu vaccine, that they produced more antibodies than those people who didn't meditate. So again, there's a lot of these different kinds of changes that can occur, and these changes can occur during the practice themselves, but also can be long-term changes. So during the practice itself, we see some very specific kinds of changes depending on the practice. So if you're doing a practice like meditation or prayer, we're now looking at a SPECT scan that is looking at changes in cerebral blood flow. The colors reflect the activity in the brain. Just to orient you, the top of the scan is the frontal lobe, the bottom of the scan is the occipital lobe. And so if you look where the frontal lobe and kind of the temporoparietal junction is, that languid verbal conceptual area is, this is the baseline scan when they're just at rest, and this is during the practice of meditation. So you see an increase of this red activity occurring in the frontal lobe and also in this language area. This was a verbal prayer practice. So you see activation in the language areas, but you also see increased activity in the frontal lobe because they are focusing attention. They're focusing their concentration on the prayer itself. And we see this in other practices that engage attentional focus on the breath, on a mantra, whatever it is that you're focusing on. And now here is another baseline scan of a person that is, now we're looking at the arrow here where the parietal lobe is. You can see in the baseline, there's a similar amount of activity all the way around the brain. It's almost all in reds here. But when the person goes into a deep meditation practice, this parietal lobe actually starts to quiet down very dramatically. You can see how it's completely different now than what you see in the baseline scan. Now, why is that important? Well, if you remember, the parietal lobe is involved in the spatial representation of the self. And so when it turns on, it's taking sensory information to help us, to give us a sense of self. So what happens when it shuts down? Well, we start to lose that sense of self. We start to lose the perspective of the boundaries and the spatial distinctions between ourself and the rest of the world. And this is a commonly described experience that people have when they feel something spiritual. They feel that they lose themselves. They feel that they feel bonded or connected to the congregation, to God, to the universe. And so that sense of oneness, that sense of connectedness seems to be a very important part of these experiences, which seems to be associated with a change in the parietal lobe activity. There are also neurochemical changes that occur in the body as well as in the brain. So we've looked at some of them in terms of like the dopamine and changes in blood flow, but people have found increases in GABA, one of the main inhibitory neurotransmitters and the site of anti-anxiety drugs like the benzodiazepines, increases in serotonin. Again, the idea that you're having more serotonin in the brain, which may be something similar to what you see when you take an SSRI. And hence we might start to understand again the physiological relationship between reductions in anxiety and depression when people are engaged in these kinds of practices. And there are decreases in the stress hormones like norepinephrine and cortisol. So we start to see that the overall feeling that the person has is calmness, quiescence, reduction in stress, and an improvement in anxiety and depression. So ultimately, and this is coming down to the end here, this does still raise some fascinating questions. What is the, and we sort of addressed this when we were talking, when you had the question earlier, what is a control? What are people doing? What are they feeling? And how ultimately do we know whether or not these unusual experiences, these incredible spiritual experiences, enlightenment experiences, what do they really mean for people? We can take scientific approaches, we can ask questions, we can do brain scans, and that's all very well and good and helpful for us to try to tease out what's really going on with people. But of course, there is the religious and spiritual perspective on all of this, that these are truly experiences where somebody is connected to God. These are truly experiences where someone connects to the universe or connects to some universal consciousness. And of course, science exists within our everyday reality, which, to us makes a lot of sense and helps us to understand our world. But these very powerful experiences for people have some very unique qualities to them. In fact, one of the ones that has always intrigued me a lot is that people, not only do they say that these experiences are real, but they actually describe them as being more real than our everyday reality experience. It's a bit of an odd thought. What does that mean? We've all experienced that. We've all had very intense dreams at one point or another in our life. But when you wake up, you immediately say, oh, that was just a dream. You relegate it to an inferior perspective of reality. And now you're here in this reality and you say, this is the real reality. For the person who has an intense spiritual experience, they say, wait a minute, this reality is more like the dream, and now this spiritual experience is the more real state. Again, I'm not saying they're right or they're wrong, but this is part of, to me, what neurotheology is about, to try to understand what these experiences are, how they affect us biologically, and can we actually make some very interesting philosophical or even theological conclusions based on all of this research. So religiousness and spirituality certainly appear to be associated with a number of brain-related changes. That seems to correlate with changes in cognition, in emotions, depression, anxiety, and so forth. Specific practices seem to be particularly involved in this, and so they might be helpful for dealing with people who have brain injuries, who have Alzheimer's, Parkinson's, and so forth. There's a lot for us to learn. There's a lot of studies that are already out there looking at these kinds of things, but much more research is needed to be done in order to truly understand what practices work best under certain circumstances, how do we get people into them, and they do need to be tailored to each given individual. In integrative medicine, we talk a lot about individualizing medicine, and that really is fundamental. I did a research study that showed that doing the rosary helps to reduce anxiety. But if I had a Muslim patient who came into me and I said, well, here's a research study that shows that doing the rosary is going to reduce your anxiety, they'd look at me like I was crazy. I mean, they don't even know what the rosary is necessarily, and certainly they don't know how to do it. So it makes sense for somebody who might be Catholic to do the rosary, but maybe a Muslim patient needs to do a different kind of practice that's similar to the rosary, but might help them to reduce their anxiety or their stress, or in whatever particular way they might be able to do that. So if anyone is interested, you can look at some of my books, Neurotheology, which published with Columbia University Press, which really kind of outlines the entire field. I will give a quick plug for my next book coming out in August called Sex, God, and the Brain, which looks at the incredible similarities between spirituality and sexuality, and talks about the development, the evolutionary development of the brain, and how rituals that evolved in animals, which were primarily mating rituals, ultimately elaborated into the human brain and into the rituals that we have as part of our religious and spiritual traditions, and talks about this whole very complex relationship between our biology and our spirituality. So there's another perspective to take and to look. And on the more clinical side, Brainweaver, a book I did with our director in the integrative medicine department, Dr. Daniel Monti, which looks not only at spirituality and some of the things we talked about here, but diet and nutrition, other preventative strategies, and so forth, that can be very helpful for people who have different brain-related issues. If you'd like to look at any of the research, you can go to my website, which is andrewnewberg.com, and you can find some of the articles that I talked about, as well as some of the books. And you're welcome to follow me on Instagram as well. So I will leave it there. And my daughter keeps making me plug my Instagram thing, so she's trying to get me there. Anyway, I will leave it there. I'll stop sharing, and I'll be happy to, I think we have a little bit of time for some questions.
I have a question. Really interesting talk, Dr. Newberg. you touched on this a little bit in talking about integrative medicine and your slide on the indirect and the direct mechanisms by which religion can promote health. And I was struck by how all of those mechanisms are very kind of concrete and operationalized, and those are could be, those are intervention sort of ready that you can teach meditation, mindfulness meditation practices. You can, the functions of community, the functions of following a diet, all of these things. You could break those apart and sort of deliver them in a package that is not necessarily religious or spiritual by nature. And
Right.
thinking about the variety of different types of people out there, people come to, to health or to an incident with various backgrounds, and some people might not be open to a spiritual or religious type of approach. So I was wondering, from your thoughts on integrative medicine, how much are some of these health benefits, or what do we know about how much some of these health benefits are part of these components of these package, which can be delivered in a different way? And how essential is the role of a kind of powerful religious story or faith or belief system that holds that package together?
Right. That's a great question. And the answer is a little, it's sort of a bit of a yes to both. So, in the integrative medicine world that I live in, and when we have patients come in, we focus a lot of the therapeutic elements in a pretty secular way. I mean, we're talking about diet and nutrition. We're talking about mind-body practices like mindfulness, like yoga, which have been very secularized. We talk about other, effective ways of reducing stress and so forth, making sure that they have good social support networks, which can be a variety of different things. And so in many ways, a lot of that can be packaged completely secularly and taken out of that. And that can be very important for people, and especially for people who don't have a religious tradition, or who, are concerned about that, or who want their religious beliefs to be somewhat separated from their healthcare. And so again, to a large extent, it goes back to some of my early slides about, what is the person really thinking and feeling? What do they need? Trying to get into a little bit with them about, well, do you have religious or spiritual beliefs that are important to you? If yes, what types of beliefs are they? How do they work for you? How do they, do you incorporate them into your healthcare in a particular way? So inquiring about that, and honestly, we don't even really know the best way of asking those questions yet, although people are working on trying to figure that out. I was involved with the pastoral care team at the University of Pennsylvania for many years, and one of the ways that they started the question off was, to ask a patient, do you have any religious or spiritual beliefs that, I, as the person taking care of you, should know about, because they may have an impact on the way in which you think about your health or make decisions about your health. So, we want it to be fairly neutral, but it becomes very helpful to know whether they have those kinds of beliefs or not. But to your sort of second part of your question, what we also have learned as we've done this kind of research is that trying to get people to be compliant with various interventions is always a bit of a challenge. And so if it is something that is part of a spiritual tradition, or can be part of that, then that can be very valuable for people, because it can help to kind of bring the whole thing together and give it more emphasis and give it more meaning for them. And in fact, interestingly, when we look at different practices like mindfulness has been shown to be very effective. But when we do brain scans of people, if you're doing a practice that you're doing because you're sort of being asked to do it, you get a reaction, you get an effect, but you get a much greater effect when it is something that you truly believe in, and when you can really kind of wrap yourself, your mind and your brain around that particular thing. So, I think it is a little bit of both, and there has to be a sensitivity for the patient. What do they need? What works for them? What are they looking for? And particularly, how does their religious or spiritual beliefs, if they have them, do they have them? And if so, how does that become part of their healthcare? Because there are so many different ways of engaging all of these things, in secular ways as well as spiritual ways. But the key is finding practices that do work for them, that they feel good about. And again, even mindfulness, I've sent a lot of my patients over the years to the mindfulness program that we have at Jefferson. And I would say a large percentage of them have loved it and really felt it was, very important to them and even transformative. But I do get, 20% or so, or whatever, who I don't get it. It doesn't help. It doesn't help me. I can't do it. I've had some people who say it doesn't, even though it's secular, it doesn't coincide with my religious beliefs. So, even though if it's secular, sometimes it's problematic for people because they still have trouble incorporating into their belief system. So, I think it's always important to kind of look into that larger picture if you can, to spend the time with the patient to understand where their needs are, and to try to help them, if they do have religious or spiritual beliefs, being able to utilize them and help them to make that a part of how they engage their healthcare and their treatment. Can be very helpful in the end, but it's obviously not for everyone. So it always has to be done with a great deal of care.
Thank you.
Thank you, Dr. Newberg. That was, I don't know if you can see me, but that was I think it's a topic we don't hear at all about really, and I think it's really interesting for us to hear about it. I had a question, I guess, from, I don't know if you call it a neuroethics standpoint, but you sort of mentioned, I'm just wondering, the focus on brain findings and brain scans. How concerned are you that this type of research could also be weaponized to look at comparative efficacy of different religions? Because I can see that happening, especially in the climate today.
Yeah.
And how important is that brain outcome, or could those brain outcomes be different for different religions and practices? Or is really self-report really the most important thing here anyways at the end of the day? So what is the utility of that, and how do you see the danger of that and this research being used for sort of dogmatic purposes?
Yeah, thanks. That's a very intriguing question, something I've certainly thought a lot about. For me personally, I try to be very careful about conclusions that are drawn, what we can say. You always do have to be very careful about, saying better than, or, more than, or whatever. And I think that, part of it, from my perspective, it's just different than. And so when we look at one practice or another, it is where are the differences in the brain? In some of my earlier research, we've delineated a very complex sort of network model of the brain and how it gets activated by different things, different approaches, different practices, and so forth. So you're right that, certainly somebody could take this in a direction that could be very problematic. But I think it would be challenging to do that, even if somebody really was trying to. And I think, to me, the more relevant, point of all of this is the ability to say that that we can look at the differences, we can look at the similarities, and then, ultimately, a lot of it does come down to the nature of the experience. And it is interesting because, I'll give you one other really kind of brief but interesting example in all this. So I think I mentioned that we did a study of speaking in tongues. If I didn't, I apologize, but it's a very interesting practice. It grows out of the Pentecostal tradition. It's a very charismatic practice, and people are moving around and whirling around, and out of their mouths comes this kind of these kind of vocalizations that people sound like language, but people don't really know what they are. And what I found kind of fascinating when I was kind of offered the opportunity to do this study, and I started looking into it, for the people who are doing the speaking in tongues, to them, it is the Spirit of God that is moving through them. It's profoundly religious. It is profoundly insightful. And all of this, but there's other people who adhere to different religious traditions who think that speaking in tongues is the work of the devil, and is just the opposite. So I think there's the kind of the bigger theological question that you're bringing up, and maybe the last way to answer your question is to say that that I think this gives us a different perspective than we've ever had before. That when we're discussing these kinds of theological questions about the nature of our relationship with God and what that means, and is there a God, and what is free will, and there's all kinds of great theological questions that have a specific theological or spiritual perspective to take, but now there's also a little bit of this biology piece as well. And so I think it just adds to the conversation. And I think, I hope certainly that it is never, truly weaponized, but it does always bring up some interesting questions. And in fact, I'm sorry, the last thing I'll say about your question is that, I've sometimes thought about, almost using it as a test, so to speak. Could you do a brain scan of somebody to try to prove if they've been enlightened or something like that? And we could look for certain signatures of that, but how does one really know whether somebody's enlightened or not? And how do we measure that subjectively, biologically, and so forth? So it raises some fascinating questions, but there are those kinds of ethical issues as well. And it is something I always really emphasize in the context of neurotheology, that a great deal of care has to be taken in terms of how we conclude anything from the research studies that we do. It doesn't mean we can't conclude things, but we have to be careful about that.
Go ahead.
I do. Thank you, Dr. Newberg. It was fascinating. I come from a hospice tradition. And so I worked with, chaplains on a regular basis and people who were spiritual advisors. And, we were taught early on and always learned that pain, discomfort, anxiety is from actual, can be from spiritual issues. And it doesn't necessarily have to, it could be a person who's an atheist, a person who's a Buddhist, it doesn't matter. But we had to meet people where they were. And that was the most important thing. And so we knew that, you can give gabapentin, you can give Dilaudid, you can give OxyContin, but that pain's going to be there if they don't address that. Many times that's been our experience. And so what you're saying is so fascinating to me, because it's kind of something we've had to deal with for many years and had to work with. And I think you worked with a team as well. And I think you probably had some similar experiences in that area. So thank you so much for this. Appreciate it.
Thank you. And yes, you're absolutely right. I mean, studies not with spiritual pain, but certainly, interestingly, I don't know if you saw this, but there was a study of like romantic pain, when people break up with people, and it activates the same pain centers as the physical pain centers. And so I, be pretty confident that you'd see the same thing with spiritual pain. And so, yeah, helping people work through that, irrespective of what their beliefs are, what that may mean for them, or how they might be able to understand those big philosophical, spiritual questions, whatever it is, and helping them to manage that effectively, I think is extremely valuable and extremely helpful. And, I think an important point, if I haven't said this, is that, I think I said this maybe earlier in the presentation, but, if I'm a doctor, I am not a religious or spiritual person, in the sense that I'm not, a clergy, I'm not a minister or anything like that. So I'm not fully comfortable talking to somebody about all of those different things, but I'm comfortable enough to say, what do you need? What are the issues that I should be aware of? And then if they need somebody in pastoral care who can help them with those kinds of issues, or help me help them with those kinds of issues, then that becomes the important aspect of how we begin to address that with the particular patient. But I appreciate your comment, and it is very relevant, because it really shows us that, how all of this is kind of wrapped up together in terms of their brain and their psyche, their social interactions and their spiritual interactions. So it's all very relevant and very tied together.
I had a question about the sort of the phenomenology of spirituality and religiosity. And I think I get from the beginning of your talk that we probably don't want to stay here till we operationally define each of those terms to our mutual satisfaction. But if I'm not mistaken, you included in your sort of definition of spirituality not just the experience of connectedness, but the pursuit of that experience.
Right.
And so I'm curious about, it seems to me that there are a fair number of people, or at least there's one sitting at the end of this table, who has had what I would call spiritual experiences, accidentally in particular contexts or moments, but that hasn't led me to now go looking for another and another. So how do you think about the pursuit part as central or not central to these experiences?
Yeah, I thank you for raising that. When I was part of that group, that piece of it was the part that I actually struggled with a lot. I kind of acquiesced to my colleagues a little bit, because they kind of define that pursuit in very, very broad ways. So, it could be just, do you reflect on it, in the future? Do you ever spend time trying to understand it again, without necessarily pursuing a specific tradition or something like that? But maybe the best way to answer your question, though, is that whatever definitions we start with, I think will necessarily change as we talk to people. And part of what I've been trying to do more recently in terms of different data. So I published a book recently called The Varieties of Spiritual Experience. And that was based on a survey that we ran of about where we got about 2,000 respondents online that talked about their spiritual experiences. And they were from all different backgrounds, including atheistic and agnostic. Part of what I think is so important, and this addresses maybe a couple of the comments that have already been made, is that a lot of neurotheology is about asking questions, and it's about asking questions, not just taking, the Buddhas of the world and the Mother Teresas of the world and so forth, but to ask the common person, the everyday person, what do you think? What do you believe? What do you feel? What experiences did you have? And so that's why I love this survey that we did, because we got away from, the descriptions of mystical experiences from the great mystics of history. And we just asked people, so here we have people from, all ages, from, I think probably the youngest was about, 12 or 13 up to into their 90s, males, female, all, again, across all different domains of human being. And to me, it was fascinating. And yeah, we had a number of people who really wanted to get to these experiences. We had other people where it just hit them and it just happened. And so all of this helps us to understand the nature of what these experiences are and the nature of what we mean by spirituality. And we might have to, modify. Again, I don't necessarily adhere to those definitions for myself, although I think that there's some value in them. But I think there seems to be something that makes people say that was spiritual. And I don't always know exactly what that means. We through our research, we came up with certain core elements, like a sense of unity, a sense of clarity, a sense of intensity, and so forth. But but are those spiritual, or is it spiritual because it was just the most incredible experience that the person ever had? So there's a lot of different issues that continue to need to be looked at, refined. And so my guess is that we'll continue to try to define these terms over and over. And as we get more data and more information, the better, and again, I think it's almost more important, instead of asking a group of clergy what they think are these definitions and what what spirituality is, to ask the people who are sitting there in the congregation what they think. It'd be really fascinating to know if they match up.
I have a specific question about, you had showed that nice table showing all these beneficial effects of meditation. And I think Dr. Edwards has a question after this, of meditation practice. And sort of two interrelated questions. One is, I'm curious about why you or anyone defines meditation as spiritual per se. It's not inherently spiritual or not. I mean, people make up. And in fact, as you well know, mindfulness meditation in many practices involves really focusing on the breath, focusing on the body, slowing down the breathing, making your autonomic nervous system kind of come online. And so in terms of active ingredients, it would seem to me that those could be likely very powerful and very separable from spirituality. And so I wonder, is there some conflation, do you think, in not necessarily your thinking, but in the literature about these concepts that you really could pull apart and look separately at, and then just a related tag on that is, you talked briefly, and I've seen it many times, that people say, I can't meditate, I'm not good at it. And those are the people for whom it doesn't work, quote, it doesn't work, and they reject it. And what differentiates people who can eventually figure out how to do it? And, are those, can we see differences in their neural signatures of, when people are able to meditate or not able to, is there a correlation between their imaging data and their self-report? I think is it.
Right. Well, your last question is a study that I've been longing to do, because we really don't know. The problem with meditation, as you mentioned, I mean, there's thousands of different practices. Some of them are deeply spiritual, some of them are completely non-spiritual, and everywhere in between. And so part of the problem is, if you came to me as your doctor with an ear infection, I would know what kind of antibiotic to give you because I know ear infections are mostly, you know, one type of organism. And if you came in with a skin infection, I would give you a different thing. So we know which antibiotics work for which kinds of things, but we don't really know for sure which meditation practices really work best under certain circumstances. I you know, if a 20-year-old college student came to me nervous about you know, finals and midterms, you know, I don't know if mindfulness is better than doing transcendental meditation. And if you're a 70-year-old who just lost a spouse, you know, again, I don't, it's hard to know exactly what works best. I think to some degree, again, I'd love to develop that data.
You know,
What
I don't think that's really I think first is really, for me, would be the question of, is there a certain state that you can self-report, that you feel that you've transcended your body, or that is the core ingredient across many different kinds of meditation practices?
Well, I mean, that is an important part, but you know, to your point, and I've talked about this in some of our work and some of our books, is that, I mean, you know, sometimes people get sort of the wrong idea that if you're going to do meditation, it's going to work. Like you need to be doing it for hours a day. You know, the data show that you could do a breathing technique for about 60 seconds and reduce your heart rate and reduce your anxiety. So, you know, there's definitely, it's challenging to know exactly what are the active ingredients and what are the elements of those practices. And, you know, even again, the problem is that on one hand, we can try to separate things out, but then there's also the concern about that. Mindfulness comes from the Buddhist, you know, kind of the Buddhist development. Yoga comes from Hindu practices. So focusing on the breath, you know, many spiritual people realize that focusing on the breath is really a spiritual process. But if we don't talk about it as being spiritual, then it becomes a secular process. But, you know, so is the spiritual kind of, you know, implicitly interwoven into that or not? I don't know. Again, I mean, this is where I think it becomes important for us to ask more questions. It'd be great to go into a mindfulness group and ask them, did you feel something spiritual? Did you not? How much did it improve your anxiety? Did it, you know, are there correlations? And, you know, I think there's still a lot of information, a lot of data that we need to learn about. But to your first part of the question, you know, I don't mean to imply that meditation is always spiritual. Certainly it's not, but we know that, you know, if you're doing a not, you know, a secular breathing meditation, then it's probably a good comparison to a spiritual breathing meditation, because at least there's certain elements that are overlapping. But that we, you know, it's exciting to have been able to do all of this research to date, but I often feel like we're really just scratching the surface. And I apologize, but I do want to answer this part of the question, which is that what I feel and what I've sort of advised people about is that you kind of have to start by taking some stock in yourself. Why do you want to do this particular, you know, what are you looking for? What are your goals? Do you want to reduce anxiety? Do you want to improve your cognition and so forth? Then I think it's helpful to do homework and to look at different practices, to look at the literature and see what's been done, what practices might be useful in achieving the goals that you have. And then ultimately part of it is trying them, you know, to try a practice that you think might be beneficial to you. You know, and also it's helpful not only to do your homework in terms of like looking at the internet, but if you're going to say, okay, I'm going to join this mindfulness group, to talk to the teacher and make sure that, you know, that you seem to be in sync with where they're heading with all of this. And then you try it, and you know, you have to give it some reasonable try, usually a couple of months or something like that. And if it's not working, or if it doesn't feel right, or if it's making you stressed more, then it isn't obviously the right one. But the good news is there's thousands of different types. So, you know, just because, you know, you haven't found one that works, doesn't mean that you haven't, you know, that all of them will not work for you. I think usually it's a matter of kind of, you know, finding the right combination to the lock. And but sometimes that's hard to do. And then there's other people who it's like, whatever they do, they just love, you know, so that we don't know yet.
Dylan, did you have a question on the?
Yes, if you don't mind, it's just Dylan Edwards here. Thank you very much. A terrific, very interesting lecture and interesting work. This might have already been touched on, I guess. We have several answers that you've given. So I like the idea of the definitions at the start. I find it very challenging to try and define, you know, religion and spirituality. In my mind, I'm thinking about, I don't have a background in this, but I'm imagining in one case, you might consider that the person has an external locus of control. I'm not a psychologist. We have many in the room who are expert in this. The other one might have more of an internal locus of control. And this might be a key differentiating factor for whether you empower someone to help themselves or whether they might need, and that might guide what is prescribed for them. I like your practical approach of actually asking patients, do they have spiritual or religious beliefs that you might be able to capitalize on and use to help them in their treatment. So as I was thinking about it, if, you know, for the practical, for the person trying to understand whether for the patient in front of them, there might be something useful for them, and given the complexities, is there a rating scale? Is there some kind of scale that you could assess the person's susceptibility to interventions that might be useful for them? So taking something really complicated and bringing it down to something quite simple. And the example I thought of years ago, I remember looking at the literature for motor skill learning, and they were trying to introduce this concept of motor imagery. And so people would imagine before they would do a golf shot or something, and that would be part of the routine practice, to think about the kinesthetic feeling of it. But it would only work for people who are good at doing the motor imagery, something like that. So you'd have to have a scale to how good people are at being able to do this to see. So I was wondering whether that we could be reduced to, as well as having the practical, just ask the patient if there's something some beliefs they have that you could capitalize on. So
Yeah,
is there something like that?
Well, I think the short answer is I don't believe so. At least I haven't seen it. That doesn't mean that people haven't been. I'm sure people have been trying to develop that. One of the problems, again, and it goes back to some of the other questions, is that there are so many different kinds of meditation. So, you know, there is like a mindfulness scale. So maybe you could start by asking, you know, giving people a mindfulness scale and seeing where they are, and then think about whether or not, you know, they might be able to develop into the mindfulness programs a little bit better. You're also reminding me of sort of like the hypnotizability scale type, you know, that some people are more hypnotizable. To my knowledge, it's never been truly, you know, evaluated, or at least robustly evaluated, that, you know, in a way that could be helpful yet. And again, that's why, you know, in my little thing I was just saying a moment ago, part of it is asking the question to people about, like, well, what are their goals? You know, one of the things I try to assess with them, in knowing a little bit about different, you know, all the different practices, like mindfulness, I know is very good at sort of stopping your brain from sort of like running, your mind from running away with yourself. So when you have a patient with, you know, who had a history of cancer, and now, you know, and then they're sitting across from me and they said, you know, every time I get like a little stitch in my stomach, I start thinking, oh my gosh, you know, is that my colon cancer coming back? I'm going to have to go through radiation therapy. I'm going to need more surgery, you know, and you sort of watch them just like, like go from there. So I'm thinking, oh, well, mindfulness, I know it sort of cuts off that process. That's, or at least that's one of the goals of it. And so maybe that would be a good kind of program for this person. But then I'll have somebody else say, you know, I can't sit there and just sort of empty my mind. My mind is constantly racing. It doesn't, if I have to just sort of sit quietly, that's not going to be good. So then I think, well, you know, there are these mantra-based practices where you actually, it takes your mind's focus away because you have to focus on something else. So then I say, well, maybe you should try, you know, now again, there's never 100%, you know, I'm not saying that I have, you know, a full, you know, perfect matching ability with that. But I try to think about different practices like mantra-based practices versus mindfulness. If they say, I can't sit still, I got to move. Well, then I think about yoga, or I think about Tai Chi or something like that. These practices that involve movement as opposed to just sitting quietly. So I try to, you know, think a little bit about who they are and adapt it to a practice. So it's probably helpful for, you know, if you wanted to have at least some general categories of practices in mind, 4 or 5 different types that you might have in mind, that then as you're talking to the person, you can get a little bit of a feel for what might work better or worse for them. And I have found, you know, that, and again, this is anecdotal, but when I have somebody whose mind kind of gets away from them, when I send them to the mindfulness program, they usually come back and tell me it was an incredible program for them. And again, when I have other people who say, I can't sit still and I can't empty my mind, I need something to focus on, I do find that the mantra-based practice, they tend to respond well to that. But I don't know for sure, and I would love to develop that data to be able to do that. I keep wondering about trying to create some larger, website where people can try different practices and we can get pre and post information on them and really get a feel for which kinds of practices may be most beneficial under what circumstances. But I think we still got a ways to go.
Thank you.
But great question.
Any last question, quick questions? Well, it's almost 5 and I think we should probably wrap up. We want to thank you so much for sharing those really interesting insights with us, and you
Thank
can
you.
see it really led to a lively discussion. And we
Absolutely.
look
Feel free to
forward
connect with me.
to meeting you again. Look us up, Moss Rehabilitation Research Institute. We're a group of NIH funded and other funded researchers. So a lot of us do kind of neuroimaging related and behavioral and all kinds of stuff that's related to your work. So look forward to chatting more.
Let's stay in touch. Yeah, absolutely. And again, I keep, to answer even some of your questions, it'd be great to just throw in a question, those kinds of questionnaires, just try different things, with a group of people who you might be taking care of and seeing if it predicts response.
Yeah, where most of us are not clinicians, we're research scientists.
Right,
So
right.
yeah. So, but anyway, we maybe we can start to incorporate some of those.
I think it's one of the most missed opportunities, even just asking
Yeah.
a question like, how often do you go to a house of worship, or how open are you to different perspectives, or you could get like a mindfulness questionnaire and just see what they, and see how they respond, just a one-pagey kind of thing. So let me know. I'd be happy to talk to all of you about it and see if we can figure something out.
That's good.
Thank you.
All right.
Thank
Thank you
you.
very much, everybody. Take care.
Thank you very much.
Thank you. Bye-bye.